Good afternoon. We are happy to have you all join us for today's panel. Um, we have three phenomenal guests who are going to visit with us, and I'm going to actually just start in gentleman's order. So I'm going to start by introducing Madam Chair Sharon Cooper. Madam Chair was first elected to the Georgia General Assembly in 1996. At that point, it was District 41. Now it's House District 43. In 2002, she was elected caucus chairman by her Republican colleagues. And in 2004, she was elected majority caucus chairman, making her the highest ranking woman in the Georgia House at that time. In 2007, in response to their ever increasing committee responsibilities, she assumed the role of caucus chair emeritus. Um, Currently, Representative Cooper chairs the House Health and Human Services Committee. We all know that this is one of the busiest committees in the General Assembly. She was also appointed to chair a special committee on the Certificate of Need, as well as the chairman of Special Committee on Grady Hospital. There are a million things that I could tell you about her. We've worked together for many years. I'd like to highlight some of the bills that she's working on, and I'll do that for each of our guests. The House Bill 62, or Margie's Law, required mammography examiners to notify patients when dense breast tissue is found so it can better help diagnose early signs of breast cancer. She also sponsored House Bill 63, which was an effort to improve step therapy protocols in the state. She also filed House Bill 290, which established a pilot program that provides pre-exposure assistance to people with HIV infection. Now I'd like to move to Representative Kim Schofield. Representative Schofield serves the citizens of House District 60. It includes Southeast Atlanta, East Point, College Park, Forest Park, and Hateville. She was elected to serve in 2017. She serves on the Small Business Development Committee, Interstate Cooperation, and HHS. She was an appointed member to the Atlanta Commission on Women. Representative Schofield is very passionate about addressing issues that affect her constituents. One of the things that she's really excited about is access to quality health care, affordable housing, education, and she's very concerned about protecting the rights of her senior citizens. She's worked on several important pieces of legislation, one of which to create a grant program to encourage certain physicians to practice in underserved areas of the state. She's advocated to expand Medicaid and has helped pass homestead exemptions for senior citizens in her district. She was appointed by former Governor Nathan Deal to serve as chair of the Georgia Council on Lupus Education and Awareness. She holds a federal appointment to the Health IT Policy Committee, and she crafts legislative policy recommendations to the National Coordinator for Health IT as a framework for the development of health information. Now I'd like to move to Senator Gouche. Senator Gouche was elected to the Georgia Senate in 2010. He's a Republican representing the 51st District. That includes Fannin, Union, Gilmer, Lumpkin, White, Dawson, and parts of Pickens and Forsyth counties. He was elected as the majority whip of the Senate Majority Caucus in 2014. Prior to serving as the majority whip, he served as the secretary of the Senate Majority Caucus and chaired the Senate Transportation Committee. Senator Gouche serves as vice chair of Transportation and secretary of Appropriations. Additionally, he serves on Finance and Regulated Industries and Utility Committees, and as an ex officio on the Assignment and Rules Committee. He sponsored numerous pieces of legislation on public utilities and transportation and safety measures. He's also been a champion for the Georgia Special Needs Scholarships. One of his most recent pieces of work was Senate Bill 65, which would convert a portion of state funding that now subsidizes landline use by rural telephone companies into a pot of money to be used for projects. So I want you to help me welcome our guest. And now we're going to begin with our first question. It's for Madam Chair Cooper. Over the last few years, the Georgia legislature has addressed several shortfalls in healthcare, with the most recent being the passage of House Bill 307 last year to expand telehealth services and provide additional healthcare resources for Georgia citizens. Can you tell us about the benefits of this legislation, especially as it relates to the patient community, And can you also identify what other healthcare related issues that you feel the legislature needs to address?
Thank you. I hope you can hear me. I sound like a frog, and I apologize for that. I have bronchitis, so I sound a little froggy. The telehealth bill, under the governor's emergency orders, we could do many of the things that are in the telehealth bill. But once those emergency orders go away, we would have been back to medicine as we knew it. And, in general, a doctor could not use on a first term basis with somebody telemedicine. And the reason for that was that it's important that the patient's doctor-patient relationship is established before you start treating somebody you don't know. And so that was broadened, and the doctors were able to meet the needs of people during this pandemic that could not get to hospitals and all, or didn't want to go to the hospitals because being afraid of, being exposed to COVID. And so in order for that, all of this new expanse and use of telemedicine, which I'm really shocked, older patients really found advantageous, and especially our older citizens in rural areas where transportation was a problem. And of course, telemedicine is helpful to anybody that has transportation problems, and getting to a doctor's office is to be seen. So we put into law with, very few changes, what we had seen in occurring during the pandemic and the emergency order. The one place that we expanded or changed it a little bit was in, having this first visit where you didn't already have an existing relationship. And one of the places where you can establish that relationship pretty readily over a telephone or by video is in mental health. And I think that is the one place where we're going to see that the telehealth is really going to be used going forward, so that patients in crisis can call up, we can get referrals, they can talk to a physician and, either on the phone or by video, and begin the treatment process. So that continues that part. With other patients, you still need to have established a patient-physician relationship unless it's an emergency situation. So we really are going to see the expansion of telemedicine continue. Of course, this brings us to the point that where people don't have broadband across our state, that we really need to continue to work on expanding broadband. I'm on the committee that travels the state looking at issues in our rural areas, not only on healthcare, but education in all aspects. And we have worked really hard for that. I know there's a whole lot of money going into the expansion of broadband in rural areas. Probably won't be enough, but we are really working on that issue. When you say, and what kind of issues are going to come up on healthcare, it seems like we always need something. We're either fighting the insurance companies because they don't want to pay for the service that patients get right now. United is telling our anesthesiologists, they usually are independent practitioners. A group of them will go into a hospital and cover the anesthesia needs of the hospital. They have a different contract. Well, they are under contract with United, and now they're going back and saying, we don't like how much we said we were going to pay you, and we're not going to pay you. And you can just be an independent, you can just be out of network, and you can just take any complaints you have about what you charge to arbitration, which is exactly not what we planned when we passed the bill last year to deal with what people thought were exorbitant charges, and that they would go into arbitration between the insurance companies and the physician groups to settle those bills. So now one insurance company at least has found a way to turn what was a good bill or the use of it back on us. So we'll see what happens when we go forward on that. Every year, I just wait to see what comes down the line.
Well, Madam Chair, we certainly appreciate that. And we love your perspective, particularly about mental health and the broadband expansion. I wish that I could skip to Senator Gouche to address that broadband, but Representative Schofield, we have a very important question for you as well. And we appreciate the fact that you can bring not only a legislative perspective to this, but a personal perspective as well. So we know that the COVID-19 pandemic has highlighted a grave concern for the entire healthcare industry in the way of vaccine hesitancy. We know that this is especially true in communities of color. What are some of your recommendations for the perspective of a legislator and a patient advocate on how we can be more effective in educating the community while being thoughtful of their concerns? We also know that clinical trials are an area where we would better increase diversity and options for patients in Georgia. Do you have some suggestions to attract more diverse clinical trials, and how can we help facilitate that change?
Sure. Thank you, first of all, to Georgia Bio for the invitation. And I was on the sessions earlier, and I want to be very thankful for the efforts that everyone is making to get Georgians vaccinated. Marcus, I'm also glad to hear about the intentionality of the diversity in clinical trials, because as you know, I'm a longstanding health advocate turned policymaker, and I do have grave concerns about the impact of the COVID-19 pandemic now and beyond COVID as a person who lives with lupus. But for years, the healthcare and pharma industry have always talked about us without us. And so let's be honest, patient centricity was not a priority until it became a priority. I often get asked about the lack of trust and hesitancy in the community of colors. But the real question is, why should community of colors trust the pharma and medical community? Rather than address how we get communities of colors vaccinated, perhaps the relevant question is what interventions, processes, comorbidities, social determinants of health need to be addressed going forward before we can ask, demand, assume, or expect anything. COVID vaccine hesitancy has really confirmed what we've known all along. It's the health inequities, health disparities, medical racial divide, socioeconomic barriers to healthcare for all, not just in the midst of a pandemic, the lack of transparencies, biases, shamings, and bullying, vax versus non-vax, and discriminatory standards. And my list can go on. Actually, Georgia data shows that vaccine hesitancy in communities of colors was not based on just people's mistrust, but it was based on vaccine deserts. And by the way, to now attach workplace demands on being unvaxxed or pay a fine or lose your job is really a great way to build trust. But also the word on the street for most is that monetizing and incentivizing only creates a further lack of trust within the population that you're trying to get vaxxed. So here's my suggestions for 2022 and beyond. First of all, let's fix the bigger issue and stop just focusing on COVID. I'd be interested in the healthcare systems, the farmers, the legislators' commitment to communities of colors after COVID. We have the power to address the social determinants of health, comorbidities, and other issues that have been ignored and been dismantled for the communities. So on some level, we all do have the power, and pharma has the power, but must commit their time, resources, and money, not just because COVID is here, but after COVID. My second thing is to give incentives and resources and finances to physicians of color and advocacy groups, because we know our community, we know the needs, and we know how to fix our communities. We don't need micromanagers, we know us. So whether it's clinical trials, preventive care, we need to start being more equitable in our funding and in our legislature and provide more patient centricity. This way we won't have to fight, beg, manipulate people to trust the healthcare and pharma industry, especially during a pandemic. And lastly, we must infuse political determinants of health with social determinants of health to get sustainable change. Thanks.
Representative Schofield, we really appreciate what you've shared with us, particularly the notion of getting to know health population beyond COVID. I think there are definitely several comorbidities that can definitely stand to be explored beyond COVID. And so we really appreciate you bringing light to that. Next, Senator Gouche. Appreciate how you are patiently waiting, and we also appreciate you taking time. I know that you're doing some personal travel with your family, and so it means a lot to us that you've taken time away to kind of sit inside and chat with us. We'd like to talk with you about the expansion of telehealth services that were addressed last legislative session. Several groups, including Georgia Bio, have now turned their attention to broadband expansion to ensure that all citizens have access to these new services. We also know that broadband expansion was listed as a priority for Georgia in the American Rescue Plan Act and those funds. Can you give us an update on the expansion efforts and also where we are in the selection process for ARPA funding?
Sure, this is a topic that is near and dear to my heart. I've worked on this for a number of years now, as you know, and our colleagues in the House and the Senate have worked well, because this is a topic that I think everybody can get their arms around. It's not a political issue. It's not one that divides us, whether we're Democrat or Republican, but it's good for all of Georgia. What we found years ago, about 5 or 6 years ago through a study committee, was we really had a huge issue, not only in rural Georgia, but also in some of the more developed urban areas. We had overdevelopment in some areas where the internet lines were oversubscribed. And so there were islands and even suburban areas and urban areas around our state that had limited access to internet speeds. But primarily the problem existed in rural Georgia. And that's what we've been focusing on, is how do we get this broadband deployed out in rural areas? And some of your listeners today may be older than 50 or 60 years of age. And so if you are, you may remember the party line telephone system. When you were a kid growing up in rural America, you may have had 3 or 4 or 5 people sharing the same phone lines in a neighborhood. We still have that same infrastructure out in parts of our country, out in the rural areas of Georgia especially, and we've got to upgrade all of that. And what we found was that the lack of return on the investment for the private providers, the AT&Ts and the Windstreams of the world, just weren't willing to spend the hundreds of millions of dollars that were necessary in order to upgrade their telephone systems to provide faster internet services. We also discovered that a lot of people in rural areas, Sharon Cooper mentioned it just a moment ago, were wanting to get better medical attention, but due to the lack of transportation, they could not get to a bigger hospital, maybe from a rural South Georgia community up to Atlanta or over to Augusta to a research facility or to a level 1 or level 2 hospital. So they had to try to get someone to haul them by ambulance or some other kind of medical transport. Well, one alternative to that would be telehealth. And telehealth care is obviously a cheaper alternative. You could tie into those resources in those huge hospitals in Atlanta or around the country for that matter, if you have a specialist that needs to look or talk to a patient, and without having to transport them to those facilities, we could do that if we had access to better internet access. So we've worked on several pieces of legislation. We've implemented 3 or 4 of those. We're seeing good progress. The Amicalola EMCs of the world and the Sawney Electrics, all the EMCs are doing things now that they weren't doing 3 years ago, and they're trying to partner with the internet providers of those small communities. But what we really need is a good shot in the arm of funding, and that is what we're seeing now from the feds. We are seeing hundreds of millions of dollars coming to Georgia that Governor Kemp has stepped up and said, we're going to earmark this money strictly for internet expansion and deployment. So there's a committee that's been assembled by the governor, and there's about 10 or 15 people on that committee made up of state agency heads, legislators, and people in the industry who are looking to give out these grant funds from this ARPA funding that the Biden administration has earmarked for broadband deployment around the country. So Georgia is in a position to see maybe $300 to $400 million this year and next year to be able to push out some of these areas in rural Georgia to get this broadband internet access up to a level where we could see a huge increase in telehealth availability around our communities. And so I'm very excited about that. It's going to take roughly $1 billion to truly get Georgia up to a good competitive level. But I think over the next 2 to 3 years, we will have that funding available between the federal funds, the state funds that Governor Kemp has dedicated in the budget this year, and the private funding that we're seeing from the providers. I believe we're going to hit that $1 billion mark in the next 2 years. So I'm very excited of what I'm seeing right now.
Senator Gouche, we so much appreciate your perspective on this. And for all of our panelists, it may have seemed as though each one spoke about something different, but they all are the sum parts of what we're trying to accomplish here in Georgia when it comes to healthcare. Now I'd like to turn it over to our good friend Dorothy to close us out.
Thank you so much, Marcus. And thank you all of our legislative leaders, our distinguished presenters, and our patient panel for making this 2021 Georgia Bio Patient Alliance Summit a success. We look forward to continue these critical discussions, showcasing our best practices and pioneering the collaboration of life sciences, policymakers, and patients. We're all working together to merge our priorities to provide the best care for Georgians. We cannot do this without you. So please become a member of Georgia Bio. Visit our Patient Alliance blog on the Georgia Bio website to hear about patient advocates' experiences and why this alliance is so important to them. Send us your stories so we can share them. Through your voice, you can engage with our alliance members, become informed on critical biohealth issues, and explore how we're working together to reduce the access challenges that we all face. We will have alerts and we will have more of the life sciences updates for all of you to see. Tell your friends and colleagues to join this movement, join this platform where all voices are heard. We thank Georgia Bio and our sponsors for this notable opportunity to develop this dynamic relationship. Thank you to you, our audience, for keeping us together, giving us your attention, and lifting up your voice. We hope to hear from you, and we look forward to expanding our efforts and our connections to strengthen this Georgia Bio Patient Alliance. Thank you.